Prof, good morning and thank you very much for your time. I understand you share the view of the Alcohol Police Alliance of South Africa that government should urgently put alcohol restrictions in place ahead of the festive season. Why is that the case?
Yes, absolutely. As we're hearing about now what's happening in Port Elizabeth, I think the plans to implement these restrictions are a little bit late. We should have done that 2, 3, 4 weeks ago when we first heard about the situation. So I think we're trying to stress and urge the government to be more proactive around trying to prevent the burden of alcohol in terms of both its role in increasing the spread of the virus and also in terms of the link with trauma, that's motor vehicle trauma and violence, which puts pressure on hospital facilities. So we think the government should be taking action in terms of various areas such as availability, marketing and drink driving. So, for example, the government's plan to impose restrictions like a 9 p.m. closure of restaurants, bars and taverns in hotspot areas, we support that view and in fact believe it should have been more preemptive. So as the rise in cases happens, government should implement it rather than after it's already almost out of control and the hospitals are full. So we think that in these hotspot areas, there should certainly be a move to an earlier closing time. We support the view of a 10 p.m. curfew in those areas, but perhaps believe that it might be even necessary to have a restrictions on alcohol sales in on-consumption outlets at 6 o'clock or even 8 o'clock at night because the situation's sort of out of control in some of those areas. But in other areas where it's showing an increase, the government needs to look at sort of imposing earlier restrictions, even sort of 10 o'clock closing times for on-consumption liquor outlets.
Now, Prof, before you give us the next thought, just to come in here, I mean, some people might be thinking, here we go again, the authorities want to spoil our festive season. We've been under level 1. We are hearing about these numbers. Is there research that shows that it is a good move to curb alcohol sales, restrict the closure times of bars and restaurants and places like that? Is there research that shows it's a good move to curb infections?
Yeah, I mean, certainly. If we look at the data from the trauma data from the Western Cape Sentinel Trauma Study, which has been going on since January, we see very clear linkages right from January through various stages of the lockdown and various stages of restrictions being imposed, various restrictions being lifted. We can see very clear evidence that imposing restrictions on and off consumption sales does affect the ability of hospitals to cope and reduce the level of trauma presentations, which put so much pressure on hospital facilities. We also see this when we look at the non-natural death data going back from January. So certainly, and certainly, I understand that people want to go out. I want to go out more. I'm someone who consumes alcohol, so I understand that. But I think if we don't have a little bit of pain, we're going to see a lot more later. So I think we need to look at toning back the restrictions. We're not calling for a complete ban on liquor sales. We're saying, in the hotspot areas, certainly stop selling alcohol on consumption 10 o'clock at the latest, if not earlier, if the area is under extreme pressure.
Okay.
And at Christmas time, and certainly over the holiday periods, the 3 holiday periods coming up, we think there should be restrictions on consumption liquor sales.
Now, I understand you've made proposals to the Ministerial Advisory Committee, to the National Coronavirus Command Council. When I say you, I'm talking about the South African Medical Research Council, of which you are a part. Now, we are all waiting to hear from the President tonight, and we don't know what he's going to say, but you've made the proposal, and you said, in answering my first question, that you think this is too late. We should have done these restrictions about 4 or 5 weeks ago. Even now, though, could they still help us if they were implemented now?
Certainly, I mean, I've seen the proposals that went to the President's Council, and in terms of you particularly focusing on alcohol, they talk about limiting in these hotspot areas, and they only refer to the Garden Route and the Port Elizabeth area. Off-consumption sales limited to Monday to Thursday. I presume that will be the 9 to 5 idea that we had before. And on consumptions, pubs, taverns, restaurants, a 9 p.m. closure and a 10 p.m. curfew. I think certainly in those hotspot areas, that would be the least we should do, and perhaps even more. We should perhaps be implementing these kind of measures in areas that are seeing an increase, like Cape Metro. So as a preventative measure, so that there's no room for a really hard lockdown on liquor sales later on. So yeah, I think in those hotspot areas, it probably is too little, too late.
But very briefly, too little, too late. But we could save lives if it happened. Do we have a clear understanding? What is that the hotspots? Have we identified them properly? Are you confident that if we say this is a hotspot, indeed it is a hotspot, we're not missing another one?
Well, unfortunately, that's not a role that I'm involved in. That's probably
I just want your view. I just want your view from what you know as a researcher.
Certainly, it seems that the areas that have been identified are risk areas, and we should be looking at implementing restrictions in order to get them back to normal as quick as possible. No one wants to see this continue. And even the liquor industry, apparently in the Nelson Mandela Bay Metro, has now sending out in certain areas, 8 police stations are sending out people to patrol and go to the taverns to get them to comply. The executive mayor of Nelson Mandela Bay Metro has said the government's response has been too slow. We heard about this 3 weeks ago. So why has it taken so long to send a team there and to come up with a plan? I think clearly there's we know there's pressure. Premier Windey wants to keep the economy going. We all do. But unless we have certain targeted interventions, we may end up having a much harder lockdown. So I think we're naive if we think that we should just let everything go and then afterwards we close things down.
Yeah, Prof, thank you very much for your time this morning. Well, there you have it. Some form of restrictions are going to be needed, particularly around alcohol.